Yeast Infections by Bojidar Bojanin, Noah Downs, and Alec Evans. We hope you guys not only enjoy our presentation, but also take some knowledge away in learning how to prevent yeast infections in the future. So there are essentially three different types of yeast infections: genital yeast infections, candidiasis of skin and nails, and oral thrush. Vaginal yeast infections, obviously pertaining to females, is a very common thing, but is rarely found in males also. Candida is a naturally occurring in the vaginal area. Its growth is controlled by bacteria, but if there is an imbalance, it can lead to an overgrowth of yeast, which leads to the infection. Candidiasis of the skin and nails occur in both male and females, and is started almost the same way as vaginal overgrowth of candida. Oral thrush occurs along the lining of one's mouth and again is caused by bacterial overgrowth. It can occur in anyone, but is more likely to occur in babies and the elderly, considering they have weaker immune systems. According to the Center for Disease and Control and Prevention, it is estimated that between 5 and 7% of babies under the age of 1 month will develop oral thrush. Also, the chances of having or developing oral thrush skyrockets amongst cancer and HIV patients, where they also have weakened immune systems. The following slides are a few pictures of the examples of yeast infections. Genital yeast infections of the vagina, candidiasis of the skin and nails, and oral thrush.
Some signs and symptoms of genital yeast infections include itching, burning, soreness, rash, pain during sexual intercourse, inflammation of the vulva and vagina, vaginal discharges of off-white material that can be described as cottage cheese. The incubation period is about 12 hours to 5 days. Symptoms will worsen the longer the infection goes untreated, and however, this is not life-threatening. Also, people that have this may also experience irritability, mood swings, anxiety, or depression. Some signs and symptoms of candidiasis of skin and nails include a red rash between the fingers and toes and fingernails and toenails. Also, depending on obesity, it can be found between folds of skin that rub against each other, especially around the armpit. Some signs of candidiasis on the nails include thickness and discoloration of the toenail. Generally, this type of yeast infection can occur anywhere on any part of the body, especially where the skin is overlapping or touching and rubbing on another area of skin. Places where this is commonly found is between the fingers, toes, folds of skin that rub against each other, on the armpit, neck, groin, and under the breasts. The incubation period, again, varies from 2 to 5 days. Signs and symptoms of oral thrush include white lesions on the tongue, bad breath, dryness, difficulty in swallowing, and redness of the tongue. This is most commonly seen in infants and toddlers, which can be problematic because they have weak immune systems, and if it is not treated, then this can be troublesome for them. You can easily tell if a toddler has this because usually they have difficulty feeding, white bumps on the inside of their cheeks, also on their gums, tonsils. They also have dry and cracking skin on the corners of their mouth. And once again, the incubation period is about 2 to 5 days. Also, most commonly seen esophageal infection is in people with AIDS, and it accounts for about 50% of all esophageal infections. After coexisting with other esophageal diseases, about 2/3 of people with AIDS also have oral candidiasis.
Causative agent of yeast infections. Yeast infections, otherwise known as candidiasis, is a fungus. A fungus is described as a group of unicellular, multicellular, or syncytial pore-producing organisms feeding on organic matter, including mold, yeast, mushroom, and toadstool. The fungus that causes yeast infection is called Candida, small and thin-walled yeast that reproduce by budding. The most common disease that Candida causes is in fact vaginal yeast infections. Candida is considered a pathogen and can be found on leaves, soil, flowers, and water. Pathogenesis and virulence factors. C. albicans has the ability to infect such a diverse niche of hosts because it has a wide and inclusive range of virulence factors, including morphological transition between yeast and hyphal form, which is crucial for pathogenicity. Adhesions and invasions at the cell surface, which induce endocytosis and active penetration. Thigmotropism, which is involving contact sensing switching from the yeast to hyphal form. Also, there is secretion of hydrolytic enzymes, which after attachment induce active penetration. pH sensing and regulation help adapt to dramatic shifts in pH level and survive various conditions. And there's finally formation of biofilms, which aid in heightened resistance. Transmission of genital yeast infection. Even though yeast infections can be transferred sexually, they are not considered STDs, direct physical contact transmission. An ideal place for Candida to grow is in places of excess moisture and warmth, such as the mouth, vagina, and penis foreskin. Hence how it can be transmitted sexually. 3 out of 4 women will experience a vaginal yeast infection in their lifetime. Vaginal is the most common. Transmission of skin candidiasis. This type of yeast infection is not typically transferable from person to person. However, if you have candidiasis on your genitals, it is possible to transfer it to your partner. Direct physical contact. Transmission of oral thrush. Oral thrush is not considered contagious. However, there are some ways in which the bacteria can spread to another person. For example, a method in which this happens occurs between infant and mother during breastfeeding. The infant transfers the fungus to the mother's nipples, which become painful with red cracking skin. This is a form of direct physical contact. This can also happen vice versa, where the mother has the ability to transfer the fungus to the baby while breastfeeding. General epidemiology of yeast infections. Here are some general statistics. Approximately 75% of all females get a vaginal yeast infection during their lifetime. The oral thrush infection is not very common in the general population. It is estimated that between 5% and 7% of babies less than 1 month old will develop oral candidiasis. The prevalence of oral candidiasis among AIDS patients is estimated to be between 9 and 31%, and studies have documented clinical evidence of oral candidiasis in nearly 20% of all cancer patients.
General epidemiology of yeast infections. Continued. Endemic. These 3 types of yeast infections are not exactly endemics, but they are frequently present in populations but do not pose a serious threat. Reservoirs. Humans are reservoirs of yeast infections because our body contains natural yeast living on us, especially in the gut and liver. Prevention of yeast infections. Oral thrush prevention. The biggest one is practicing good oral hygiene, brushing and flossing regularly, mouthwash, etc. But overall health and immune system health are also a big factor. Vaginal yeast infections prevention. A key factor for females in preventing vaginal yeast infections is wearing cotton yeast infections, although the main cause of yeast infections are for the most part out of their control. Examples are pregnancy, diabetes, and certain medications. Candidiasis of skin and nails prevention. Hygiene and a strong immune system are both major factors in preventing this form of candidiasis. A common theme, obviously, is having a good immune system. Genital yeast infection treatment. There are several options of treatment for genital yeast infections. Non-prescription genital medicine, over the counter. Prescription oral or genital medicine, doctor prescribed, non-prescription boric acid capsules, and antibiotic treatments. However, there are risks to self-treatment, such that the yeast infection is a result from exposure to a sexually transmitted infection, or an STI, in which treatment of the yeast infection will not result in its removal because it is not the source of the problem. At the end of the day, the best way to treat a yeast infection is simply contacting your doctor. Oral yeast infection treatment. You should obviously seek professionals for treatment. Your doctor will prescribe an antifungal medicine in order to kill the yeast. This will either come in pill form or in the form of mouthwash. This, however, does not always work, and if the infection grows and worsens, you will be administered a powerful antifungal drug through an IV. Skin or diaper rash yeast infection treatment. There are several creams and ointments that can be applied by the affected person in the comfort of their home. However, there are much stronger medicines available through your physician. Lotrimin and Nizoral are a few examples. Specifically for diaper rash, yeast infections which occur with elderly people and babies, frequent diaper changes and use of barrier creams speeds recovery. Diaper rash is more common amongst babies with mothers that have thrush on the breast and is transferred to them via breastfeeding. One of the most common forms of a yeast infection is actually athlete's foot, which is easily treatable with over-the-counter ointments. However, when it comes to babies and elderly, it's very important that you consult your doctor as soon as possible. This is a picture of a diaper rash on a baby.